Hello, everyone, and welcome to the Emerge, Survive and Thrive webinar series. So my name is Nasi Obiado, the Junior Sales and Marketing Associate from Emerge Digital Marketing Agency. And it is my pleasure to be your host today for today's webinar with the theme Survive and Thrive, the Digital Marketing Initiative for Healthcare Now and After COVID-19. So to our participants, we are glad that you were able to join us today despite the gloomy weather and the workload that you're probably having right now. We'd also like to acknowledge all our online viewers. Hope you guys are well seated and comfortable as to where you are watching right now. As we are now halfway through the week, we would want to know how's your week been doing so far? Can you tell us by sharing your thoughts through the chat box down below or through the comments for those of you who are watching live? All right. Wow. Thank you, Miss Althea. Thank you for joining us from all the way Aklan. Also for Miss Mary Jane Beltran from Pangasinan and Ma'am Rosita Lodi of San Del Monte, Bulacan. So before we get started, I'd like to go over a few house rules. So we would want to know how to participate in today's event. In order to keep a functional good quality of our sound, I'd like to ask everyone to please keep your audio muted and your camera off and just turn them on as you were asked to do so. Should a question arise during the presentation, please send them into the question box on your control panel or into the comment section, as we will be collecting those and address them in the question and answer part of this session. We would also like to ask everyone to please stay with us all throughout the webinar, as we will be drawing two lucky winners of free 30 minutes social media consultation with our in-house social media expert. Again, we'd like to remind everyone that you may send your questions during the presentation in the chat box down below. As we commence to our program, we would like to ask everyone to complete the Emerge Digital Marketing Survey through the QR code that we are flashing right now, or through the link below that we have sent on our chat box pane. So now, without further ado, I'd like to introduce today's presenter. He is a digital marketer by heart, a brand strategy lead and a senior account manager at Emerge. He worked on a successful social media campaigns for both local and international accounts, such as food, leisure, entertainment, retail, lifestyle, aviation, fintech, information technology, and many more. He is also a co-host of the Marketinkers podcast, a graduate of marketing management in Tarlac State University, and a registered marketing professional certified by the Junior Achievement of the Philippines, or JAPI as you know it, together with the Chartered Association of Marketing Business Professional. Please welcome Mr. Jimar Merino.
Thank you, Nessie. Good afternoon, everyone, and good morning to those who are in the marketing field. Once again, my name is Jimar Merino, but you can just call me Jim for today. And thank you for joining us on our first leg of the first ever Survive and Thrive webinar series. Okay, we call it a webinar series because we will be having lots of this Survive and Thrive webinars in the coming weeks. So if you watch or if you're familiar with Fear Street trilogy on Netflix, this is kind of like it. You know, different week, different focus, or different, like a movie, but same story, which is helping you survive and thrive today and in the future. Okay, so I would like to ask the technical to pass on the sharing screen. All right. So first of all, how's everyone doing? I can see some audiences all the way from Pangasinan and Bulacan. So thank you for joining us today. Okay, so let's get started. So for today's tip, we are going to talk about the digital marketing initiatives in healthcare now and after COVID-19. Now you're probably wondering, why are we, diving into the healthcare industry? Well, since the pandemic started from March 2020, the pandemic industry was one of the most affected industry because the crisis that we are having is related to the medical field. It's the most affected industry, and it's the most ever changing industry because the healthcare industry is the leading industry in terms of innovation and improving the lives of people. So for the first leg of our Survive and Chat webinar series, we are going to help you, for those who are in the healthcare industry, to help you in your marketing or medical marketing journey. Okay, so after this webinar, I hope that you will be able to gain in-depth knowledge on how to market your products and services, of course, efficiently create great content that gets results, learn the digital marketing initiatives in the healthcare industry that can help your brand now and in the post-pandemic economy, hopefully soon. And of course, know how to survive the digital challenges and how to thrive in this pandemic. Okay, so are you ready? Just comment on your chat box if you're ready. All right, let's start. So fall time, first let me ask you guys, can you still use digital marketing, or can you still use digital marketing to bring in leads, opportunities, and sales for your business even during the pandemic? Just type in your answer on the chat box, and for those who are watching via Facebook Live, just comment your answer, yes or no, and we will know the ultimate answer later on. Okay, let's give you 5 seconds to decide. Okay, can I still use digital marketing to bring in leads, opportunities, and sales for my business even during the pandemic? Yes or no? 5, 4, 3, 2, 1. Okay. So first we have to understand the situation we are in. Okay, so these are the things that you need to know. Of course, our situation back in 2020 was one of the worst in everyone's lives. Of course, lots of people lost their jobs, lots of businesses have closed down or temporarily shut down, and some of them have been unemployed. Some of us were unemployed, and lots of mortality that happened due to the COVID-19 virus. But over the course of the end of 2020, we have picked up. Okay? We have stand up with our knees, with our heads held high. And this 2021, we are trying to bounce back more than ever, especially for brands in the healthcare industry that have faced many, many challenges, not only on the battle with the COVID-19, but also on the battle of the digital marketing field. Okay, so according to Google, gaining access to credible and timely healthcare information has become a top priority for the public. And that is very true because the public don't have access to online information every time. So as digital marketers in the healthcare industry, it's our job to provide credible information and timely healthcare information, whichever is released by the World Health Organization or the Center for Disease and Prevention. Okay, so according to Google and New York Times licensing, 7% of all Google searches are health related. I'm sure you're one of them as well. At the start of the pandemic, you have started to read some of the articles connected to the pandemic and what is happening to the world. And the second fact is that 70,000 searches per minute every 24 hours are health related. And most of them are connected to the COVID-19 virus. However, 47% of people, or the population of those who search on Google, are concerned about the contents that are trying to sell something rather than provide accurate information about what they are looking for. Imagine you have someone you are taking care of, they are having emergency, and you are searching for answers on Google, and instead of trying to look for solutions, they are filling your screens with ads and everything about their business and not helping you out on the emergency that you are having. So that's the major concerns of some of the people. Why is that? Why is that happening? Why is there a lot of people who are searching on Google or searching online for answers about medical problems, but still they are having concerns about the information that they are given. You know, we are going to know the answer later. But first, we have to understand saan nga ba nanggagaling yung discovery about the brand and saan sila nagre-research or where did they look for about their brand. Okay, so this information is provided by the We Are Social or Hootsuite group in their yearly review for the social media statistics. And in the Philippines, the top 5 places where people discover your brand, accidentally, not intentionally, are from ads on social media. That's number one. Second, ads on television or the commercials. Third, the websites or the results on your Google search. Next is word of mouth recommendations, even though we're, social distancing, word of mouth recommendation still prevails. And fifth is recommendations or comments on social media. So that's very helpful. On the other hand, if people are intentionally looking for answers or looking for information about their brand, this is where they go. First is the social networks. Do you have a Facebook page, an Instagram page, a LinkedIn account, or are you even available online to talk to? Next is the search engines. So nandiyan si Google, si Yahoo, si Bing. Then third is consumer reviews. So if you have a website, that is where they probably go. And then fourth is websites. So they scan every page of your website just to look for information. And last, if mobile apps, if you are lucky enough to have a mobile app for your own brand, this is where they search as well. Okay, so next fall time, what should be the primary use of social media in digital marketing for healthcare? What do you think? Which of the two? Is it more on selling or is it more on informing? Just type in your answers in our chat box. And for those who are watching via Facebook Live, please type in your comments. Again, what should be the primary use of social media in digital marketing for healthcare? Is it for selling or is it for informing? 5, 4, 3, 2, 1. We'll get to know your answers later on. Okay, next part is knowing how to survive. How to keep moving forward in the middle of a crisis. And let's admit it, we are still in the middle of a crisis, even 1 year after the first imposition of the lockdown here in the island of Luzon. I mean, there's no progress. But still, we're here and we're trying to bounce back with our healthcare industry and we are trying to help them move forward. Okay, so first fact, the pandemic has increased the importance of digital communications and value delivery. On the onset of pandemic last year, we have noticed several brands in the medical field, increasing their budgets on online strategies, and they are costing less on the out of house or out of home advertising, which means billboard, lamp posts, banners. Instead, they are moving that cost into online strategies on Google search, on Facebook ads, YouTube ads, you name it. And of course, people are always looking for value. If I choose this hospital, if I choose this brand of medicine, if I choose this person or doctor, will I get value from my purchase? Because of course, the demand and supply is getting very stringent, And people are looking for value na masasabi na hindi sila nagsayang ng pera. That's the key of that. Okay, so the biggest threat in the digital landscape until now, even before the pandemic, is the spreading of fake news. If you have noticed, since last year then, a lot of fake news or pages containing fake information or false credentials have been spreading online. And let's not deny it, some of us are very gullible and quick on sharing because you are enticed or you are scared of what you have seen and not, of course, verifying the information. And that is where it starts. If you verify the information first, there's no need to be scared. So as digital marketers in the medical field or just simply people, advocating for the frontliners, let's prove the credibility first and get the facts right. The number one major source that we can get is from the World Health Organization, because they are the number one or leading organization that is handling the COVID pandemic. Next is the Center for Disease and Prevention Center, which is also based in the US. And they have been helping us since the onset of the pandemic in providing correct information. So if you get your sources from blogs, from bloggers, or influencers, shut them down. Okay, what we need is credible information from these organizations and from trustworthy people, not just celebrity or influencers that you see online. Okay. So how to connect with your audience if you're trying to survive and they're also trying to survive, right? So you have to speak with empathy, talk to them in their shoes. And this is not very, this is very old school na nga. You have to remember that you have to show and not tell your patients about the experience they would receive. Your content should be filled with empathic and you-centric content. When we say you-centric, we are talking about you as the customer. Okay, so sa kanya lahat ng focus, wag mo nang ibida yung brand mo or wag mo nang ibida yung kung ano man yung product mo. Because you can, relay it in a subtle way and not just ambushing information about your product and not what would be the benefit for the customer. You have to offer patients with a comforting and supportive journey through their healthcare. Okay, so be the guide and not the distraction. Next is turn boring data into infographics. In the medical field, of course, we are bound by many restrictions and ethical rules for the doctors and the other staff inside the healthcare industry. But these practices are bound by regulations kasi, and sometimes we have to follow by the rules. And the problem is that we are limited by the creativity that these regulations impose on us. So you should consider how you will present this data to your audience without, scrolling up, ang boring thing na. Or maraming text. I will not read this many texts. So what you can do is create infographics that can give information, but also pleasing to the eyes while sort of entertaining your customer online. Because that is the key. Even if you're not an expert, on digital design or digital graphics design, you can use many tools that can help you in creating an infographic. Take Canva for an example. There are templates, lots of templates for infographics that you can use and just replace the text with your information and just pick some logos or icons that you can use, and voila, you have your own infographics that you can share in the online world. Next is the power of storytelling. This is no secret. Of course, heartwarming stories affect the audience, something that they can connect with on a personal level. Because if they see that the person they are watching is struggling from a certain illness or a certain struggle, and they are also struggling with it, they can connect. And of course, they will engage themselves with the content. Share their information on the comment section, share the videos, and sometimes, message the creator of the video and say, can you also can you also get my story? I want to share it with the world. So, ganun dapat tayo, ka-open sa ating mga customers or audiences in general. Then all of that strategies, you have to execute it with a video. Because videos are the most effective media or content that is evident in all or major social media platforms, in Facebook, on YouTube, of course, on TikTok, Instagram, Twitter, anything that you are joining in, there are always some video contents that you get to engage with. Okay, so number one rule is to make sure it's optimized for mobile viewing. So people on TikTok or people on Facebook don't have a problem with this because they are already have an aspect ratio of a vertical size video when creating content. But for us, of course, storyboarding and production-wise, we cannot be, expensive or major on production because lo-fi videos are also now a trend. Lo-fi videos means low production. You don't need experts to go in video or expensive devices. So yeah, you just have to use your creative juices and create the best possible video that you can create. Super time. Which one best describes the approach of your brand and in medical marketing? Should you be a storyteller or should you be the one to give the facts or a trivial person? Share your answers in your chat box, and for our viewers on our Facebook Live, just comment below on the comment section. Again, which one best describes the approach of your brand in medical marketing? Is it being a storyteller or being the one to give the facts? 5, 4, 3, 2, 1. Okay, we'll know the answers later on. So we're on the part of tribe. And in tribe, as much as possible, the goal is not to be a boring brand. Okay, so maybe you're already evaluating, well, is my brand boring? What makes a brand boring ba? So let's get to know how. So first, boring brands compete on price. A fascinating brand should inspire. Okay, so the medical industry is already in the Red Sea, if you're familiar with it. And to be able to jump on the blue ocean from the red ocean, you have to not be like the others that makes the price their unique selling proposition. Because people don't care. It's their lives that is at stake. So, kung ano pa yung mas makapagbigay ng value sa kanila, yun yung papansin nila kaysa sabihin mo, oy, makakatipid ka when you avail of the service. No. You should inspire people and make them guess na ikaw na yung pipiliin kasi ang galing mo, na-inspire ba ako to do this. So, be that advocate, Next is boring brands keep us chained on the old ways or traditional strategies in marketing. You should make space for innovation. So what are the innovations? This is something na ikaw pa lang yung gagawa, lalo na on the digital field. What others are doing is already ineffective for you. Okay, so you should be the one to lead the way and make change. Next, boring brands are easy to ignore. Unnoticeable. Because if you already notice, people have an attention span as short as a goldfish. That's 3 to 5 seconds. So within the 3 to 5 seconds, kung nabore na sila sa nakita nila, scroll up na. That's how we are on TikTok or on video watch portion in Facebook, right? So take a look at the examples below. We are inciting people to take action with just a few words and an image. And these are the two I believe are the most effective ones that I've seen that best describes how we should incite people to take action. It's okay to use fear. It's okay to use aggression just to get your point. So you should incite people to take action and not just be a boring brand that will be unnoticeable on the feed of everyone's mobile devices. So how does it all come together? How do we survive and thrive all together? First, we use the always-on marketing communications. If you have a switch in your room, of course, we have that switch for off button to close down the lights, and we have the on button to keep the light bulb on and shining. So that's the same with our surviving and thriving strategy, which is to keep the light bulb open, always on. And by this, because always on marketing is a planned approach to scheduling and optimizing continuous marketing activities which support customer acquisition and retention. Ibig sabihin, lahat ng gagawin ni customer online, dapat meron kang solution na may inject or may i-insert sa kung ano man yung ginagawa niya. So let's use the customer journey map to understand the always on better now. Because once visitors are aware of your brand na, their interest can be nurtured by marketing automation techniques such as this na gagawin natin. Okay, so how do we inject a digital solution to our customers' everyday journey? First, we understand how do they behave in a customer journey map. Okay, so first we have the realize and discover stage, which in they think. I think I have a fever or magkakasakit ata ako. Should I go to the doctor? Should I, just ask my mom for meds? Basta doon niya palang na-discover or na-realize na meron something wrong sa katawan niya. Then next would be considering options. Where should I go? Where should I go and where should I buy medicines or something like that. And then the third stage would be planning. Kung nararamdaman niya na lumalala na yung sakit niya or talagang nag-iinit na siya or naglalagnat na, i-consider niya na malapit lang ba yung hospital? Do they have the best facilities and the best doctors and staff? Will they take care of me? So yun yung planning stage niya na. No? And then on the booking and buying, you are already scheduling an appointment for a checkup. So maybe on the same day or tomorrow, all of this customer journey can be done in the same day. No? Next is experience, which is going to the actual appointment. And if they are going to confinement or an ongoing treatment, of course, they will experience the whole thing for 1 day, 3 days, or 1 week. Then once the patient is discharged, he is evaluating that. Did the doctor and staff help me? Well, kaya nga siya na-discharge because gumaling siya, diba? And iisipin niya na kung ano yung naramdaman niya during those times. Kung naging easy ba yung journey niya para gumaling, or did the staff or did the doctors made it worse? And on the final stage, it's sharing. I want people to know what I experience. I-share ko to. So that's the end of the customer journey map. From realizing that you have something wrong or something, an opportunity for you to do something, and it ends with sharing to let others people know what you did or what you have experienced. So as simple as that, you have to understand the customer journey and put yourself in the shoes of the customers to able to inject a digital solution. So next is using the direct-to-customer model or the D2C. Okay, so this is the use of digital media channels for brands to communicate their propositions and sometimes deliver the services directly to the customer. So from the word itself, direct to customer, from the moment na na-realize ni patient, nandun ka na hanggang sa end, hanggang sa na-deliver mo na yung service mo and you have delivered value. So, for example, to the thoughts of the patient earlier with this one, this is the step-by-step steps of the patient that we have injected digital solutions to her or his every step of the customer journey. Okay, so first, the patient clicked an ad, okay, because nagsasearch siya ng answers online. So, may nakita siya na nagpa-interest sa kanya, which is can be a banner ad or an ad on Facebook or a short ad on YouTube. And then he sent an inquiry, maybe on the Facebook page, the message button, then may nakausap siyang chatbot, or maybe someone have called her na because he or she submitted her contact details na. Next is book an online consultation or teleconsultation, let's call it. And after nila mag-usap ni doctor for the official checkup, the patient received digital prescription and then sent it to an online pharmacy para makuha niya yung medicine. And then wala, nakuha niya yun because there are logistics partners na that delivers medicine right to your doorstep para hindi ka na lumabas. And next is to share the experience or share your review. So saan ka pumapasok dito as a digital marketing in the healthcare industry? Sa lahat. Because unang-una, ikaw dapat yung piliin nila when they click an ad. And then kung nag-send na sila ng inquiry, that's intentional na. They have an interest na on doing that. Then on the booking on the online consultation and reviewing the digital prescription, they have your trust na. And then when they deliver the medicine via online pharmacy, nakuha mo na talaga yung loob niya because yun yung service, yun yung goal niya from the start. That's why they click the ad. And then it's up to them if they will share a positive or negative review, but somehow always positive lang dapat yung ginugol natin, right? Next is having digital engagements. Digital engagements, in a sense, in this industry is the activity between pharmaceutical companies, healthcare practitioners, providers such as the hospitals, and patients to proactively connect with, understand, and support each other. Ibig sabihin, walang robotic system na kausap sila. This is just pure heart-to-hearts. Okay, so it provides value, the number one na hinahanap ng patients, that they seek for multi-channels in which the brand interacts with them. So for example, yung mga email marketing, mga SMS messages, the banner ads, the chatbots, and apps and articles. So doon pa lang sa email marketing and SMS, if nagre-reply na yung brand sa'yo, that's actually a digital engagement. And it's up to them on how to build that relationship with the customer to get their trust. And in return, loyalty yung ibibigay nila. So kada may mangyayari emergency, balik sila ng balik sa'yo. Okay, so let me give you an example that is the most effective in our agency, which is using the Facebook content strategy. And I believe most of you naman have a Facebook account for your page or the brand that you are handling, right? So doing a Facebook content strategy is dictating the kind of content that we should show depending on the activities that the customers are engaging in. So we have three types of activities: the on-the-go, the lean-back, and the lean-forward. First, the on-the-go, preoccupied siya with something else. And it usually in the morning or on the way to the office, way to school, pero of course pandemic, so ano lang tayo, homeschool. This is something na nagmamadali siya. So limited lang yung attention niya. So dapat yung ipapakita nating content on this type of people should be short and concise, such as GIFs, teasers, mga one-liner na copies and then one image, ganun lang. And usually, mga people na to are nagmamadali. So, limited lang yung attention nila sa yours. And then the next one is the lean back people. Okay, so ito yung mga pinaka-relax. After they eat or nagpapahinga na sila before sleeping, may time na sila to scroll. And the content na ipapakita mo dito could be long form. You could show articles, you could show videos that are more than 30 seconds, you could write copies that have 3 or more paragraphs, and you could show the infographics that you have created. And the last one are the lean forward people. They are willing to dive in your content because they are waiting for something else. For example, they have a doctor's appointment. And before their doctor's appointment, they want to search for their own, research for their own, kung ano nga ba yung nararamdaman nila. So they will look for symptoms, kung ano nga ba yung sagot na maibibigay sa kanya ng doctor, or what will be the expectation kapag nag-usap na sila ni doctor before the consultation or after the consultation. And the user is more willing to delve into longer but not immersive content. Ibig sabihin, pag magpapakita sa kanya ng content, hindi niya kailangan lumabas dun sa platform. Okay, so you will not give him a link or you will not give him something na magpapalabas sa kanya sa Facebook because Facebook will also not allow you to do that. Okay, so taking into account the duration on how the attention span of an average user lasts from the shortest to the longest, you should also categorize on what type of content you need to show. So, kung shorter yung attention span ng people mo, usually in the morning or in the evening, mga rush hour, you should always show GIFs or short bits, mga 1 to 15 seconds, mga stories on your Facebook, My Day, or IG stories, you should utilize that as well. Mga videos, short videos, carousel ads, if you're using Facebook ads, some canvas, or just simple pictures with a copy or a caption, some collection of images, maximum na yung 4, that is already good. Some Facebook Live kung hindi sila masyadong preoccupied because that's on the lean back na. Okay, so nagpapahinga sila, so kung may mapansin sila, uy, naka-live, papanoorin ko siya saglit. Ganun yon. And then we have the lean forward. So ito yung mga mas longer yung attention span nila. So dito pwede kang magbigay ng lahat ng information gusto mong ibigay. So it can be a landing page, it can be a link to your website, or it can be just a screenshot of any information that you have. Basta hindi siya gagawa ng maraming activities or hindi mo siya instruct to do something else. Just make him understand or eat the content. Yun yung sinasabi, eat the content. Okay, so you have known how to survive and thrive and how to apply, hopefully. So these are just the things to remember before you start in your content journey. First is put content first. Okay, So, not brand, not product, basta don't sell. Just sell your personality, just sell your brand, just sell the position that you are trying to achieve dun sa customer. Okay, are you trustworthy? Ano mo ba yung mga service na achieve mo? Or did you have prove yourself worthy of the customer's trust and loyalty? Next is talk to your audience using their language. And I'm not talking about the literal language, whether to use English or Filipino, that's your choice according to your brand rule or brand book. But you should be relevant enough na may intindihan ka ng customers mo. But don't try too hard. So infographics has a way of helping you in that case because some terms in the medical field, are very hard to understand. And it's our job to make the layman understand na parang kahit grade 1, may intindihin na kung ano yung sinabi natin. And not just because we are in the medical field, we have to be intimidating to our audience. We just have to be very down to earth and be relevant enough na makaka-connect sila sa mga content na nilalabas natin. Next is choose the most effective platform because you cannot have it all or you cannot success in all platforms with just one strategy. If you choose one platform, that's great, but you have to come up with another strategy in another platform that you have chosen. The key here is you choose what works best for you because the goal here is to get your audience to look at your brand the way the internet looks at Keanu Reeves because everybody loves Keanu Reeves. So this is a sample strategy. So you have 5 different platforms and what are you going to do with each of them? First, on Facebook, you just have to use your page to share some announcement, space announcements. And then if you have Twitter, you will use that for quick conversations with your audience. Q&A nga. One question, one answer, that's it. That's the content. Next is visual thematic. You use images. You use aesthetics to capture your audience and you have to tell a story with an image and a few words. Don't have to be all bloggy about it. Next is YouTube for content creation. So if you are, resourceful enough to create video contents, this is the perfect avenue for you. And you can just use your Facebook page to share or announce that you have a new video that has been uploaded on your YouTube channel. And then last is email. You use email marketing, to remind your patients, oh, we have this new service, we have this new center, or we have this type of celebration this month. So you use email for that. Last is to monitor, measure, and tweak. So you have to measure the results and track the right metrics that works for you and tweak the content as much as possible and always check for improvement. Because what Prince Harry says, you have to improvise, adapt, and overcome in order to survive and thrive in this pandemic. Okay, so to help you out, these are some of the metrics that you should really monitor when you are creating your marketing strategies. First is on the Facebook, of course, you have likes or reactions, shares, comments, clicks on your posts. Okay, so we have this metric na binabantayan minsan, which is what are the buttons did the audience click in your post? Is it the image? Is it the content? Is it your Facebook page name? Because when they click your name, they can visit your page directly. So did they do that? Yan, napapag-aralan din yon. Next is the engagement rate, of course, how many percentage of your entire audience have commented or shared your content. Referral traffics, of course, the tagging of the people. Video views if you have videos on your feed, and then conversions, more on the ads part. No? Next is email. So if you use email, you have to look out for the number of reach. How many people did your email reach or pumasok doon sa email apps nila, usually Gmail, of course. Then you have open. Did they open your email? And then the click rate. If they click anything on your email, if you have a link, did they click that? If you have social media channels that you want them to visit, did they click on that? And then bounce rates are just the number of emails that did not receive your email because it's either the email does not exist or they have a restriction or firewall to not receive some ads from certain companies. Then conversions. If you have a landing page as well, or you're wanting to register for something, that's the conversion rate that you have to be checking. Next is for Instagram. For simple lang, the follower counts, the likes, the comments, and the referral traffic or the tagging of other users for them to check out your posts. You know, ganun lang kasimple yung meaning ng referral traffic if you're wondering. It's just the tagging of other people on your platform. Then website, of course, duration of visit. If they visited your website, that's great. But how long did they visit your profile? Is it only 5 seconds, 10 seconds, 30 seconds? So you have to also create metrics for that. Then referral traffic, if they are sharing the link of your website to other people. Next is most visited pages. Of course, if you have a website and you have different sections on that, you have to also check which part of the website are the people mostly or frequently visiting. Is it the contact pages or some of your services or about us? So you have to check that as well. And then conversions, if you want them to register for something as well, that counts as conversion. Okay, so going back to our first poll earlier, can I still use digital marketing to bring in leads, opportunities in sales for my business, even during the pandemic? Yes or no? This is your last chance to comment your answer. Okay, so just go to your chat box and provide your answer on the poll. Is it a yes or no? Can I still use digital marketing to bring in leads, opportunities in sales for my business, even during the pandemic? And if I may add, even after the post-pandemic economy, which is hopefully soon. Huh? And if you'll ask me, the answer would definitely be yes. Of course, digital marketing can help you survive and thrive. And we have been helping businesses, survive and thrive to give them sales or just raise awareness and make the people trust them. So yes, digital marketing is very useful now and always. And that's it. Thank you guys for joining in once again. I'm Jimar Merino, but you can just call me Jim. And I am passing on my mic to our host, Nessie. Thank you guys.
Okay, thank you, Jim, and thank you for that valuable presentation. Hope all our participants have learned a thing or two from that insightful and fruitful presentation of yours. So now, for those who have clarification or questions, it is now the time to send them into the chat box down below or onto the comment section for those who are watching via Facebook Live. Okay, so we will now proceed to our first raffle draw. Mr. Spin the Wheel, can you show us who will be our first lucky winner of the 30 minutes social media consultation? All right. Congratulations, Mr. Orlando Jr. Evangelista. Sir, are you there? Can you please send us your complete name to confirm your pricing or to confirm your winning on the chat box down below? Mr. Orlando Evangelista. Okay, so let's give him 5 seconds to confirm his attendance. 5, 4, 3, 2, 1. Okay, Mr. Spin the Wheel, can we spin it again? Looks like Mr. Orlando is not around. Congratulations, Miss Shailene. Suruth. Miss Shailene, are you there? Can you please send us your complete name on the chat box? Okay, so let's give another 5 seconds for Miss Shailene. 5, 4, 2, 1. All right. Looks like Miss Shailene is not around. Also, Mr. Spin the wheel. Let's spin it again. Okay, Miss Elna Trugane, may we please ask to please send us your confirmation on the chat box? Miss Elna. Okay, let's give another 5 seconds for Miss Elna Trugane. All right, go ahead, Mr. Spin the wheel. Again this time, hopefully we will now get our lucky winner. Miss Mary Jel Boyalde. Hi, ma'am. Are you there? Miss Mary J. Boyalde. Can you please send us your complete name on the chat box pane to confirm your attendance if you are here? Miss Boyalde. Okay. Looks like Miss Mary Moyalde is not around also. Mr. Spin the wheel. Mary Grace Sukayan. All right, Miss Mary Grace Sukayan, can you please send us your complete name on the chat box down below? Miss Mary Grace. Okay, so Mr. Spin the wheel, can you spin another one for the last time? And we will now proceed to the our documentation. So for Mr. Randy Seed, would like to ask sir for your confirmation on the chat box pane. All right. Oh, it looks like Mr. Randy is not around also. We will now be proceeding to our documentation and we will be continuing this raffle draw after the question and answer portion. So before we proceed to the question and answer, may we request everyone to please turn on your cameras and can you flash your beautiful smiles for the documentation?
Hello, everyone. All smiles,
Yeah,
please.
all smiles, please. Okay. Let's wait for everyone to open their cameras.
It's raining hard over here in Sarlac. I hope you guys are safe and well in your own locations.
Okay, so I guess that's will do now. Okay. Let's take a picture in 5, 4, 3, 2, 1. Okay. Thank you guys. You may now turn off your cameras. Okay, so we will now proceed to the question and answer part of this event. Again, just a reminder, please be sure to send your questions into the chat box or into the comment section. Okay, anyone? Anyone who have clarification and questions? From our Facebook Live viewers, any questions and clarification? All right, from Mr. Harold Bacani. Hi, question po. How do you know which information to add or omit for social media content, especially since healthcare can sometimes be information heavy? Thank you, Sir Harold Bacani, for that question.
Thank you, Harold. It's just a matter of ranking the usefulness of the information. Kasi kung ilalabas mo lahat, alin ba doon yung magagamit ng audience or ng customers if they saw your content? Kasi kung ibobombard mo sila with all information lang na nakalap mo, of course, they will get tired or they will get fatigued in viewing your content. So just choose what's useful and what's relevant to the current situation. Because the news from the past will not be as relevant as today. So just, rank in its accordance to its usefulness. Thank you.
All right, thank you, Chief. I hope, Mr. Harold, that answers your questions. So, is there anyone else who would like to ask? Okay, it looks like we've covered all of our questions already, Sir Jim. Okay, should there be further questions on your end that you forgot to mention, we will be flashing our contact details on the screen, so you could reach us out if you wish to do so. Okay, so all right. So now, we will now proceed to the second raffle draw. And together with the first raffle draw, as we were not able to get our first lucky winner. Mr. Spin the Wheel, can you show us who will be our 2 lucky winners of 30 minutes social media consultation? Congratulations, Miss Harlin May Sunio. Hi, Bam. Can you please send us your confirmation on the chat box pane? Okay, so okay, let's spin it again, Mr. Spin the Wheel. Yeah. Hopefully, Miss Bia Flor is here with us. Miss Bia, please confirm your attendance. Hello, Miss Bia. Okay, we will be drawing another three draws, and after that, we will proceed to the announcement and closing remarks. So, Mr. Spindle, go ahead. Mr. Dio Vincent Encinares, sir, will you please send us your confirmation on the chat box pane? Mr. Dio Vincent? Okay, so we are now down for the last two draws. Mr. Spin the wheel. Mr. Jeffrey Lee. Sir, can you send us your confirmation? Okay, let's give him another 5 seconds to confirm. Mr. Jeffrey Lee. Okay, for the last time, Mr. Spin the wheel. Hopefully we will get our lucky winners. Congratulations, Mr. Jever Kaimel Kang. Sir, can you please send us your confirmation on the chat box pane? Okay, let's give another 5 seconds and we will now proceed to our last part of this session. Okay, I guess that's it for our raffle draw. We will now be proceeding to the last part of this session. Okay, so good afternoon again, everyone. So before we totally end this webinar, we would like to announce to please watch out for the second series of Emerge Survive and Thrive webinar, where we will be tackling about the digital marketing initiative for the food and beverages industry. You may check out our official Facebook page for announcements. It's Emerge Local, and you may also visit Metro Clark Guide official Facebook page. It is our media partner who promotes Metro Clark as the next growth area in the Philippines. So on behalf of Emerge Digital Marketing Agency and the presenter, I'd like to thank each and every one of you for joining us today. This has been Nessie, your host. Enjoy the rest of the day and we'll see you on the next. Thank you, everyone.
Thank you, everyone.